Hello, everyone, and welcome to Crucial Conversations, Session 2, The Invisible Impact of Substance Use on Your Team. My name is Max Backer, and I'm the Community Manager here at Work It Health, and I'm delighted to be your host as we discuss this incredibly important topic. If you'd like to say hello in the chat, please do. You can let us know where you're zooming in from or what organization or company you're a part of. Also, we want to let you know that if you have a question or a comment throughout this panel, please go ahead and put it in chat, and I will make sure the panelists answer it at the end. If you missed session 1, no worries. We have that session uploaded. Just so you know, session 1 details how to look for signs that your employee may be struggling with a substance use problem, and then how to prepare for and then engage with that employee. And I will get that in chat in one moment. A little bit about Work It Health first. We are a discreet, accessible, and clinically proven solution to substance use disorders and other things. Work It Health offers on-demand intervention, relapse prevention, and addiction treatment that is accessible and delivers evidence-based medical-assisted treatment, CBT, DBT, psychoeducation, counseling, coaching, and more. And if you have any questions on Work It Health in general, we'd be also happy to answer those as well. Today's panelists, we have Faye Zenoff, MBA, Vice President of Partnerships for Work It Health, and we have Grant Voiles, Behavioral Health Lead in Georgia for Work It Health. Unfortunately, Dr. Brian Spitzbergen couldn't make it today. And we're going to get right to it, y'all. Talking to you about the invisible impact of substance use disorder on your team. I'm going to go ahead and stop sharing for now, and I actually have a poll for y'all. All right, going to set that now. What percentage of people with substance use disorder are employed? Go ahead. You can anonymously answer this question as well. All right, and the answer is 75%. So there's a really good chance that you've encountered or worked with someone with a substance use disorder. So let's get into this conversation. As a quick refresher, what is the scope of the problem of substance use and workplace wellness? Who would like to kick us off?
I'm happy to do that. Thanks, Max. Hi, everyone. Thanks for joining us. One of the reasons this is a crucial conversation, just based on the poll that you saw, 75% of people with a substance use disorder are employed, but only 1 in 10 will find help. So that means that people are suffering silently and perhaps invisibly. Just in terms of the impact on employers and employees, we know that people who are engaged in or active in an addiction or dependence on a substance tend to miss 2 or 3 times as many days of work due to hangovers, illness, or other reasons. People who are engaged in illicit substance use or dependence tend to have, I think it's 65% of workplace accidents are related to alcohol use. There's an uptick in workers' comp. There's lower morale. Actually, since COVID, a recent study indicated that nearly half of all employees have increased their use of substances, and 50% or 49% indicate that their relationship with alcohol or other drugs is troublesome. So whereas historically the data was about 10% of people have a substance use disorder, now the uptick since COVID is much greater, 5 times. So the impact is that employers spend much more time and money on healthcare costs, lost productivity, absenteeism, retraining, turnover, and employees spend much more time distracted, in pain, and needing support and help, and they don't know where to go. Does that cover it, Grant, Max? Is there more to say there?
Absolutely. And I'm glad that you mentioned, during the pandemic, we've seen these numbers increase greatly. So beyond those struggling with substance use themselves, what are some ways that the organization as a whole is impacted by addiction?
I want to just say to that point, we think about there's the afflicted, the people with the actual substance use, but then there's also the impacted, and that is the employees and the colleagues around them that are impacted by this person's use. There are the loved ones. There are those that are recovering and perhaps are also invisible because of shame and stigma associated. Um, and so there is, I think, upwards of 40 or 50% of employees are impacted, whether it be from a morale point of view or productivity point of view. But when we have this great emphasis on health and wellness in our culture right now, this is one of those conditions that is still greatly stigmatized. And so it's not readily apparent how that group or those groupings of people can get support and help.
And how does an individual team member's drug or alcohol use impact their fellow teammates?
I'll jump in on that one. Hi, everyone. I'm Grant, and I am the behavioral health lead down in Georgia. Looking at how an individual member's drug or alcohol use affects, the team and affects even the organization as a whole, I was liken it to when you throw a large stone in the pond. You have the big splash from where that stone went in, and then you have those ripples, and those ripples may go out very, very far, may cover the entire pond. It's usually very easy to see or to understand the effects that the drug or alcohol use has on the person who is using it. Those can be the lack of focus, lack of productivity, not hitting the marks with quality or with quantity of work, as well as just the tardiness, the absenteeism. But outside of that, all of those things typically will affect their coworkers and the organization as a whole. When you have an employee or employees that have an issue with substances and you're dealing with all of that, it puts added stress on the rest of the team. It puts added stress on the rest of the workforce, because either you're not hitting the marks that you want to hit, the work's not getting done, or somebody else on the team is having to step in either by choice or by being told to, and finish the rest of that work, take care of this, tighten this up, because somebody didn't do it or was not able to do it. That causes a lot of low morale, even if people aren't quite sure that there's drug use or alcohol use going on. There can be tension between coworkers, there can be tension between workers and the managers or supervisors. This process also can lead to disciplinary procedures. If a person is not performing at their best or not, showing up for work or showing up on time, oftentimes you begin the process of write-ups, the process of performance improvement plans, that sort of things. And anybody who's worked as a manager or a supervisor knows that that is a very time-consuming experience. It takes time, it can be stressful, and then it can eventually lead to termination. When you have employees leaving, whether it's them being terminated or they feel the workplace is too negative and there's too low morale, so they decide to take a job elsewhere, then you have an open position that has to be filled. And you have to go through the process of advertising for that position, interviewing, filling the position, and then training a whole new person to do that job. It can be very, very time consuming. Having your staff short can be very stressful on everyone and the organization as a whole. It's also very costly. It can be very expensive to find and train new quality employees. So it is one of the things when you look at someone with an issue with substances, whether it be alcohol, other drugs, things like that, there is the micro and macro effects of it. And it goes everywhere from, on the ground level, the people that work with that individual, often all the way to the top of the organization or company, especially if there are multiple individuals who are struggling with a substance use problem.
I really appreciate what you just shared, Grant. And, I've heard this concept actually. There is, just like secondhand smoking, there is secondhand drinking, which is, it impacts the people around us. And there is this tendency in our culture to blame an individual for their behavior and not look at how culturally and socially we are setting up a dynamic that does not support an individual who is not going along with the majority's lifestyle or behaviors. So in this case, a person with a substance use disorder might be out with colleagues, and everybody's celebrating a recent win, and they are, let's have a drink, let's have a toast, everybody have a sip of this champagne or this whiskey, just one, come on, you can do it. And there's this unintentional discrimination. It's like completely unintentional, but there is peer pressure, and there is this cultural norm. Even if you think about advertising, where a alcohol company will say, drink responsibly, as if a person has a choice. And many people do. Many people can say, you know what, I'm just going to have one because I know that it would be dangerous for me to get behind the wheel. But those of us who have a substance use disorder, once that alcohol is in our system, it impacts our thinking and our behavior in a way that we can no longer intellectually and consciously make responsible choices. So to ask us to do so puts the onus on someone who's not able to, if that makes sense. So I wanted to throw that out there, because I don't think people who are not familiar with this understand, why can't you just have one? Or why can't you just drink water? What's the big problem? And it is this disorder, and I'm not a behavioral health expert, but we literally have a brain disorder that does not allow us to either stop the compulsive desire or use.
Thank you, Faye and Grant. I just adore the ripple metaphor. I think that's very apt. What kind of challenging dynamics happen in the workplace that are invisible related to someone dealing with substance use issues? And then if you could give an example as well.
Yeah, I mean, much like what I just shared about a management practice or a cultural norm where we celebrate a win with champagne, or we wine and dine a client, or we create the expectation that drinking alcohol is part of the camaraderie and the culture. That's an invisible challenge or dynamic that puts 30% of adults who don't drink for a variety of reasons in an awkward situation that other people might not be aware of and sensitive to. I don't know, Grant, if you have another example. I speak from being someone who worked in a large organization in recovery, where alcohol consumption, even other drugs, was condoned, because even if we were on stimulants, we were high producers, or even if we were drinking, we were fun. And once I got sober and entered recovery, though I was much more effective in terms of being coherent and focused, I didn't fit in anymore culturally. And so ultimately left that role.
All right. Well, I'd like to launch poll 2 for the audience members. And if you're watching from home, the question is, what percentage of workers have said they were put in danger, injured, had to redo a project, or work extra hours due to a colleague's substance use? And the options are 5%, 10%, 21%, or 33%. You can answer that anonymously. All right, and the answer is 21%, which is a significant number. I'd like to take this moment to segue to, sometimes it's not the employer themselves that is experiencing the addiction, but they are impacted by it at home, meaning they have a partner or a roommate or a child who is struggling with a substance use disorder. Now, how can that situation at home affect a person at work?
Well, see if I can tackle this one. Really looking at home life and what it would be like to live with someone who has an issue with substances, and realizing that the person may know that their spouse, partner, child, parent, whoever they live with is using substances. They may not know that they're using substances. But either way, what is going to happen is, just in very simple terms, increased stress. Just like at the workplace level, it translates the same at the home. Typically, there's going to be increased conflict. There's going to be some lying to them. They may know they're being lied to. They may not know they're being lied to. Either way, there's a very good chance that is happening. There could be financial problems at the house or at the home, because of someone's drug or alcohol use disorder. There may be a lack of sleep. There may be a lack of peace. And remember that home is where we want to be able to go to relax and to unwind and to recharge. And when that environment is disrupted and it becomes, not just a place where we can't rest, but can become a place that's very chaotic, that's very unpredictable, and sometimes it becomes a place that's not even safe. It's not a good environment at all. The person may become displaced because of this, and they have to move out, or the person they're living with has to move out, which changes the entire dynamic, may change a financial situation or a family type situation. All of this is going to increase a lot of stress, which will affect anybody, physically, mentally, emotionally. When we talk about burnout a lot, and usually burnout is related, when we talk about it, it's about somebody working too much or working too many hours and they're burning out from work. But really, burnout is from just being exposed to a high level of stress for too long. And you can burn out from your home life. And if you have lived or do live with someone who has an issue with alcohol or other drugs, that added stress can make you burn out very, very quickly or very often. And that can carry over into the workplace, of course. Fatigue, lack of focus, irritability, forgetfulness, tardiness, is all, even more prone to getting physically sick. Literally, your immune system gets worn down. All of that can happen, which affects the ability for somebody to do their job. It may affect their passion or their focus to do their job, even if they have the actual ability to do that. So it has very far-reaching effects, which will, the home life will affect the work life, which then can affect the other employees and affect the organization as a whole as well. So it's very far-reaching, and sometimes the stress from home life may be even more detrimental than the stress from work life, and this can be an example for that.
Grant, I want to say you bring up such a great point in terms of the invisible impact, because imagine if that same colleague had a spouse or a child struggling with cancer. Most likely, colleagues and the manager would know, and we would have great empathy, even if their spouse or their other housemate has COVID. People understand, oh my gosh, let us know how we can support you, and we give them slack to not show up in the same way. But due to stigma and shame related to this issue, a person who is experiencing high stress at home might not share that. So it's the behavior that would be indicators, but it's not clear what's really going on. And I think that's why we call it, secondhand impact or the ripple effect.
Now, a question that may be on everyone's mind right now is who in the organization or the company is responsible for providing resources and support to an employee who is struggling with substance use. Again, whether it's themselves or a fellow employee or a loved one at home.
You know, before we jump into the clinical responses, Grant, I just want to say organizations that have employee resource groups that are for people in recovery or people dealing with issues associated with substances, that's a great place. If that is visible, that is an opportunity for people to see there's a solution and other colleagues are dealing with this. People in the organization that are open about their own recovery become role models that a person who's struggling knows that they're not alone and perhaps can approach that person. So those are the unofficial individuals or ways people can get support. But Grant, I defer to you.
Thank you, Faye. And, you know, with this question, if I was to give a very short, concise answer, I could easily say everyone. But, you know, to break it down a little bit, I think the first thing is to look at the difference in providing resources versus providing support, because those are not necessarily the same thing. When we're providing resources to an employee that maybe is struggling with an issue with alcohol or other drugs, we are pointing them in the direction of somewhere they can get some help. That can be anything from individual therapy, a full-on type of treatment, whether that be, you know, outpatient treatment, inpatient treatment, telehealth treatment, something on the professional level. It can also be some of those things like support groups, you know, Families Anonymous, Alcoholics Anonymous, Celebrate, Smart. You know, there's a plethora of different support groups out there. Those are usually not as professionally run, so to say. They're more peer run, but again, a place where they can get support. If it comes to, you know, you're not sure where to refer to somebody, or you think they could benefit from some type of help or some type of treatment, but you're not sure, you know, what direction to point them in, that's always a good time to sort of defer to an expert, or to defer to someone with more experience maybe than yourself. It's a good time to look towards your EAP, HR, like Faye said, maybe somebody who is in recovery themselves, and you know that's well known. You know, don't be afraid to ask for some help on that, because typically, you know, I think a lot of the general public doesn't really necessarily know how to navigate the treatment process. When it comes to support, that is the act of being supportive for someone. Sometimes it can be just as simple as, you know, sitting, listening to that person, letting them verbalize what is going on and sort of talk it out. And I can say my experience as a counselor, oftentimes if you let somebody talk out their problems, they come to a solution themselves, with me actually having to say very, very little. The other way to support someone is sometimes the harder way, but that is for employees and for managers to set boundaries with other workers who maybe are having some struggles with it. And we set boundaries by not taking responsibilities off of them. We don't rescue them when, you know, there has been a mistake or they've fallen short. We try not to cover for them, you know, don't lie for them, don't let them borrow money. And all of those things, you know, obviously sometimes that's, you know, feels a little awkward, or that can be in the tough love genre, but that is doing two things. That is letting that person with the issue with alcohol or other drugs, you know, feel the natural consequences or the natural results of their behavior, which oftentimes is a very important part of getting to a place where they are ready to change their behavior. It also protects ourselves by us not overextending ourselves and trying to to enable or to protect someone whose behavior maybe is not where it needs to be. That helps keep us protected. It helps keep us from burning out a little bit. It keeps us from building up a little resentment. So it's important that, while we do want to support the person with the alcohol or drug issue, we also want to support ourselves and want to support, the other members or workers who are having to work around that. So it's very much a balancing act, but basically everybody sort of has to be there to help support everybody else.
Great.
Thank you, Grant. And finally, kind of to put this all together, why is this a workplace issue? What are the benefits of supporting employees in navigating addiction support services?
I would just respond, first of all, and say, at least right now in our economy, there is great competition to attract and retain employees. And so employers who are at the forefront of providing resources, support, recognizing the complexities that employees deal with in their lives, so that we feel that this is an organization that understands us and supports us, and therefore we can show up fully and give it our all. So I think it's part of an employer being competitive for their talent. I think it's also for an employee to feel loyal and engaged. And I think it's also just like employers support their employees to be healthy in every other way, so too with mental health issues and behavioral health issues.
Absolutely. And I think, looking back on, what we just talked about, obviously we can see that the cost to individuals and to organizations can be very great, can be very far reaching. So by helping support and helping get people, into treatment or into a place where they're ready to change their behavior, reaps some very real and tangible benefits for the
Indeed.
organizations. And, looking at my personal experience, almost every place I have worked talks about, workplace as a family. That, we are family. We spend more time with our coworkers than our biological families sometimes. And looking at that, we want to be supportive of each other. Families want to be supportive of each other. I think in general, it's human nature to want to be helpful, to want to try and help each other succeed, especially if we're looking at the workplace as a family environment or a team environment. And when that happens, when employees see that happening, that other employees and the managers and the supervisors are really trying to help or are really putting people's best interests first, that raises morale, that raises loyalty, that just makes everybody feel a lot better. They feel a lot more relaxed. They feel a lot more at home. I think with that, you have increases in retention, you have increases in productivity, and you have just a more positive place to work. And if we're spending so much time at our place of work, we want it to be as positive as possible. And I think this is one of the many ways that helps us get there.
And speaking of support and resources, we want to make sure we send you with some resources, of course. Contact us here at Work It Health. Again, we offer coaching, counseling, and treatment, and much more. Be sure to view session 1. I put the link in the chat. Internal resources, you might want to contact your EAP department, your benefits coordinator. And of course, there's also external resources. We've got the Substance Abuse and Mental Health Services Administration website up there. And we also want to, support Al-Anon, family groups and such as great resources. Treatment modalities and therapy types, we've got plenty these days, including digital programs like Work at Health, intensive inpatient and outpatient programs, peer-based fellowships such as AA and Al-Anon, CBT, DBT, private talk therapy, and medication-assisted treatment, which is also something that Work at Health does. And what's next? Creating a recovery conducive culture. Please save the date, for our third and final session on June 15th from 1 to 1:30 p.m. Again, we'll be talking about cultivating a recovery conducive culture, what to do with happy hours, how to not only support your employees who are struggling with substance use disorder, but also those who are in recovery and beyond. And so I'm going to check the chat and see if we have any questions from our audience. I know we went a few minutes over. I think we're good. I think you answered the questions perfectly, y'all. All right, well, again, here's the link to register for our third and final session for Crucial Conversations. And thank you so much, Faye and Grant. Loved hearing your insight and your stories. And we will see you in session 3. Thank you so much.
Thank you so much.